The foundations for Transform and Sustain were very much about creating a platform where we had control of our finances and were performing well as an organisation. That took us a few years. Now we're in a position whereby we can go well beyond that by supporting our staff better, listening to our patients and our community, to what they need and want.
The way that Transform and Sustain came about was started with a small executive team, a core of ideas, but they were really taken out and discussed with our whole health community. We had 62 meetings, we got back 285 bullet-pointed ideas, and we really changed the policy to reflect what people were telling us. Transform and Sustain really has three aims. The first is to keep our population healthy. Healthy population, less overwhelming of our services. The second is to concentrate on quality in our services. Good services delivered well are actually really cost effective. And the third is to manage within one pot of money. We need to get the most population health and the best quality services we can with it.
Transform Sustain for me means a way of working differently, a way of making sure that we put the patient at the centre and we work across one health sector as an integrated approach. We need to provide our services differently. We need to be responsive to the changing population needs. Examples of those are our increased elderly population, therefore we'll have more burden of disease, more chronic illness to look after there.
So the implications of Transform and Sustain are very much that we've often, as an organisation, focused on the needs of the organisation, the needs of staff groups in that organisation, rather than the needs of our patients. And I think going forward, what we have to focus on is what matters to you, not what's the matter with you. So AIM 24/7 is an initiative in the hospital which is there to improve patient flow. We've listened to what staff tell us can be done to improve services. We've involved patients, and as a consequence we're seeing patient flow through the hospital improve, and there's a better quality of care being delivered for our patients, and also it's a better working environment for our staff. So better for patients, better for staff.
What we want to do is to unleash the power of people's innovation. We want to permit people to come up with the ideas, to work through the solutions, and to tell us what we need to be doing as an organisation. And if you unleash that huge potential in people, before you know it, there are hundreds of examples of great practice and improvement all around the organisation.